Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
And staying strong. And this is something that we talk about just about every issue. But they emphasized the fact that getting enough protein, which of course can be obtained by meat or by plants, but they recommend plant-based diet over a meat-based diet. And they mention the importance of making sure that your vitamin D level is normal. And we've talked about that before. And then uh, emphasize the point that omega-3 antioxidants are found in sufficient quantity in fish that they recommend fish being a major source of your protein and omega-3 antioxidants, emphasizing staying hydrated. And then they talked about the product we talked about last week, I think, creatine as being an important muscle builder in addition to your standard exercises. So that they talk about the importance of strength training, especially as you age. As you get over 60, your muscles deteriorate. And if you don't have exercises and take creatine and other things, and don't have that 30 minutes a day at least of exercising, your muscles get weaker and weaker, and you have more trouble with falling. And as we know, falling is the number one cause of death in people that are our ages. So it's interesting to see an article that actually emphasized how important our diet is, which is what uh, we've talked about in this group for, I guess, forever, especially with Darryl's emphasis, which is very well stated and an important cog in what we do every week. So I thought I'd just mention that uh, before we start on going reviewing our articles. Any comments on diet and exercise? They don't talk, very few people actually talk about the role of meditation, but I think that's as important as because I think you're building up your mind and your spirit is as important as building up your body. Any other comments?
Um, I have a question about the creatinine. And
Creatine,
yeah,
not creatinine.
oh,
Creatine.
okay. Well, I could be getting it mixed up with the kidney.
No, not creatine. Creatine is different, right?
Okay, thank you.
Yeah, it's a compound that most muscle builders take because they try to build up their muscles. That they mentioned people who are aging, since their muscle mass is decreasing, how that may be helpful in overcoming the muscle deficiency.
I'm glad you mentioned that, Tatum, because yeah, I was thinking the same thing. Creatinine and creatine, two different
Right,
chemicals.
absolutely. Right.
Thanks.
Yeah. Back on a comment about fish being a supply of omega 3s, um, the problem with fish is that it's increasingly become full of plastic, microplastics. So, as an alternative, you could do seaweed, you could buy it in the store as nori, and it has plenty of omega 3s. It's where the fish get their omega 3s from.
Thank you for sharing, Dan. Any other comments?
From Linda.
Can't
That
hear
was
you, Pearl.
Pearl.
From Linda.
Say it one more time, Pearl.
Can't hear you.
I don't really think she's trying to say anything. I think she just hadn't muted herself.
Okay, so we can start the articles, John Buchanan. Well, this is an article that talks about the important things you can do to prevent cancer. As we talk about the fact that as we age, the likelihood of dying from falls. So as you age, the likelihood of dying from cancer increases as well. And the American Cancer Society's data found that 40% of the new cancers are preventable. And these are some of the steps that they're emphasizing. Uh, uh, Eating more fruits, vegetables, whole grains, and beans. These are things that we talk about all the time. Cooking with plant oil such as olive and canola oil instead of butter. Limiting your intake of red meat. Avoid sugar-sweetened drinks and ultra-processed foods. Then, of course, something that we tend to do little of, a lot less than we should, is using sunscreens and ultraviolet glasses and hats and protective clothing to protect yourself from the damage of the sun exposure. Then, of course, limiting and avoiding alcoholic beverages, and then getting vaccinated is something that we emphasize more and more. And it's interesting because Secretary of Health emphasizes it less and less, but still we're emphasizing it more and more. And then, of course, getting a colonoscopy between the ages of 45 and 75. Over 75, it all depends on who you are and who your doctor is and how healthy you are. If your life expectancy is more than 5 years and you're in good health, the recommendation is that you get colonoscopy. But if that is not the case, then recommended over 75. Then, of course, the exercise regularly is something that is important as well. And then stopping smoking or not smoking at all is something that is interesting, because I think that very few of the articles I've read actually appreciate the importance of meditation. And I think that's the one thing I would add to the other things that are already here. Any comments about the 10 items that we put together as things that you need to do to decrease your likelihood of getting cancer as you age, which as like falling are the leading causes of death in people over 65.
I have a comment on number 5, sun exposure. So as far as the occupations, fishermen have some of the highest incidence of skin cancer. That's because the sun reflects off of the water as well as the direct sunlight. So, but if you're going to use sunblock, you really need to make sure that it's reef safe sunblock. And there's some chemicals in most of the sunblocks up until like 6 years ago that kill the coral. And, you know, the tiny fish eat the coral and the bigger fish eat the tiny fish, and we eat the big fish. So we need those reefs. We need the coral. As far as our, you know, the source of our diet, our source of our food. So please, as you, and we definitely, I mean, people, a lot of people think that Black people cannot sunburn, but yes, yeah, we can. And we can get skin cancer as a result of overexposure. So that's my recommendation. Thanks.
Thank you very much for sharing. Any other comments?
I have a comment. Uh, we have to be careful about osteoporosis when we age too. And bone density is an issue.
Right. Yeah, right. Bone density is an issue, as is vitamin D. And bone, if the bones are not strong and you've got osteoporosis, then you don't exercise, the likelihood of falling becomes very common, and that's the number one cause of death in people over 65. So thank you for sharing that important point.
I have a question too. Um, the issue of spinal stenosis, is that we talk about the same thing as bone density?
No, no. Spinal stenosis is a situation where the vertebral column squeezes the nerves as they come out of the spinal cord. And this is a very kind of malignant issue that can cause you to be paralyzed, cause you to be unable to walk. And it's a cause of morbidity that is more common than you would expect. But it is, uh, it causes paresis and paralysis and inability to move around, and eventually can cause you to actually be paralyzed. So that it's a condition that is more common than you would think. But I have a number of my patients who've had spinal stenosis, who've had to have corrective surgery for that.
Thank you.
Any other comments? If not, we'll move on to the next article. Uh, it's interesting that this intermittent fasting and type 2 diabetes uh, come up because one of the things this article talks about is the fact that if if you have type 2 diabetes and you are taking insulin, then you need to be careful about intermittent fasting because hypoglycemia is a complication that can kill you. So you have to really, if you're a diabetic and you're doing intermittent fasting, you have to be sure you know what your blood sugars are and whether or not you're going to induce hypoglycemia because hypoglycemia kills just as hyperglycemia kills. So you don't want to be too high or too low. But with intermittent fasting, if it's not done carefully and you're not monitoring your blood sugars, it can cause a situation in which your blood sugar drops so low that you lose consciousness and actually can die. So knowing what your blood sugars are, whether you're intermittently fasting or not, becomes critical. And if as long as you do that, if you wanted to do intermittent fasting, it's it's doable, but you have to be careful about that. Betty Blaylout?
Yes. Is that just for the type 2 diabetes that take insulin that
It's
you
with type 2 diabetes,
period or
particularly those who take insulin. But if you're taking
pill?
medication that lowers your blood sugar, then knowing what your blood sugar is becomes important.
Okay. Okay.
But especially those who are taking insulin. Yeah.
Okay. And the reason why I ask is because my husband was kind of doing what I was doing when I was doing that stop eating at 4 o'clock. And he is a diabetic, but he's just on pills. But he does check his sugar and
Yeah, that's the important part of it, checking your sugar, being sure that it's staying around 90 or thereabouts. Because when it goes down below 70, then you have problems.
41.
Oh, yeah.
Today is 102.
Okay, so you doing better. Yeah, he hadn't checked it for a couple of days and it did go up, but it's going back down.
Even the medicine.
Okay. He said he wasn't taking his medicine. Mhm.
Hmm. Okay. Any other comments or questions? If not, uh, this is a interesting blood test that I wondered whether we should include it when you have 75% false alarms, which makes it null and void. But anyway, this is work they did that was published in uh, uh, outside of the United States. I forget whether it's China or Japan, but there's no point of getting a test like this if you have 75% false alarms, because that's worse than anything else. But down the road, I think there'll come a time when tests like this can be made more utilizable. It's not that it hasn't reached that yet, but eventually, when you have a, a study like this that comes out, this can be modified and changed to the point that they get a situation where you can make a diagnosis of cancer from some of these blood tests. Not yet, but that's something down the road that will likely be evident in years to come. Okay, let's go to the next article. Uh, we grew up in an era in which tonsillectomy was often done. The question is whether tonsillectomy is necessary or not. And tonsillectomies are done with a small amount of complications, but I think it's very important that it be done for a good reason. If you have recurrent tonsillitis or other reasons that affect your breathing, that's a good reason for tonsillectomy. But the way they used to do them, and just because you had tonsils is not a good indication, and because the tonsils are lymph nodes, and if they are a source of infection, yes, they need to be removed. But if not, they don't need to be manipulated at all. So this article talks about how many years ago that almost everybody had tonsillectomies, and how that isn't necessarily the case. That if you don't have infection, if you don't have breathing problems, then tonsillectomy is probably not a necessary operation. And it's not as commonly done now as it used to be. So this is for your children and grandchildren. If you're wondering about whether they should have a tonsillectomy or not, that's an issue. John Buchanan?
Yeah, this is flashback for me. It's one of the worst memories I have of childhood was being in the doctor's office in a chair and having my tonsils removed unsuccessfully,
Oh,
and extremely painful. I mean, I cried for like a week after that,
really?
and then come to find out, I had to go to Children's Hospital later that year and had a successful adenoidectomy and tonsillectomy. And you remember the Bill Cosby routine where you can have ice cream after surgery like that? Yeah, I got ice cream, so I was happy after that. But my question is, the adenoids, aren't they also part of your immune system? Very important part.
Yes, they are. But if they are interfere with your breathing, then that becomes a reason to take them out, or if they get infected. So, yeah.
Well, yeah, I snored and I still snored after the ectomies. So I don't know.
Yeah.
That wasn't the source of my snoring.
Okay. Joyce?
I also have my adenoids
removed when I was after I graduated around 1969. And I went to they used to have the hospital for women up off Pennsylvania Avenue. That's where I had them done. And but when they told me that they couldn't find my adenoids, and my mother was real concerned about that, and they said, well, she probably just swallowed them. They were so infected. But I never understood the importance of adenoids and what happened to your adenoids when they're not there.
Well, they're just another lymph node that is protective. But if you don't have adenoids, life goes on. So similarly with the tonsils, if they don't cause any problems, it's fine. Adenoids similarly, they don't cause a problem. But we have the thymus and we have adenoids and other lymph glands that are present, but aren't absolutely necessary. Uh, because if you don't have adenoids, you may not be able to fight off all infections, but it's still compatible with life.
Right.
Yeah. Well, I was like John. The best part about it was the ice cream.
Okay. Um, let's go on to the next article. Um, this is an interesting observation that, and as time goes on, and we will learn more about the long-term effects of COVID. And this observation in the UK was that the COVID infection increased the number of people who have type 1 diabetes in children. This is something in England that they've identified that hasn't yet been identified in the United States, but it's food for thought that after having COVID, you're more likely to have type 1 diabetes, which is the diabetes in which your pancreas is not making insulin. Whether that's going to be the case that we find here in the United States remains to be seen, but this is something that they observed in the UK that may or may not be applicable here. But as time goes on, what happened in 2019, its ramifications still are not identified yet. We still have much to learn about long COVID and also about what happens if you get COVID at all. So this in children, it appears that type 1 uh, uh, diabetes, which is thought to be related to the fact that the islet cells in the pancreas are destroyed, uh, may well be another manifestation of COVID. But in the United States, we have not made this observation yet. So time will tell. We'll go to the next article if you have no comments. Now, this is an article, as we've mentioned before, the wonder drug of the 2020s is GLP-1 drugs. And as with everything, there are side effects. And this talks about the 19 side effects, some of which are important, some of which aren't. And I think we haven't seen all of them yet. We've been using these drugs since 2020, but we've yet to be able to have long-term follow-up to see what additional side effects. But this article lists 19 of them and identifies them in relationship to the commonality of the side effects and also those that are occasional findings and those that are rare. And as you go down the list, you'll see that you see the mild side effects here, which usually are temporary and tend to go away. Then you have some of the other side effects. And it's interesting that some of these side effects are also what the drug is used for kidney as well as diabetes. But the vision loss and the hypoglycemia and stomach issues are still being studied. Uh, and I think probably over the next over the next 3 to 5 years, we will have an even better idea as to uh, how to deal with the side effects of these medications, and see if the cost benefit ratio is so important that we can do things to minimize the side effects that occur. Uh, Actually, there's no drug I know of that has no side effects except maybe water, purified water. But other than that, all of the other drugs have side effects. So the question is the balance. Any comments or questions? Not too many of us are on GLP-1 drugs, so we haven't yet taken it enough to know all the side effects. But over time, we will over the next 3 to 5 years. One of the things that people talk about, though, is the rebound weight gain after you stop taking medications. You gain all the weight you lost back. But so, and then of course, as this is a treatment for diabetes, hypoglycemia, low blood sugars are also evident. Dreams, I don't know much about that, but hair loss is occurred and pancreatitis, rare. Gallbladder disease, less common as well. Kidney damage is uncommon as well, but does occur. And allergic reactions, again, are rare. Thyroid tumors is question about that. Gastroparesis seems to be temporary. And so those are, and over time, we will learn how many of these 19 are substantial and how many of them aren't, because we will have time enough to learn more about the long-term effects of the GLP-1 drugs, the drugs that are the wonder drug of 2020s. Any comments about the use of this wonder drug? And probably not too many people are familiar with uh, the use of this drug because really just started using it in 2020. A lot of it related to its cost, and also the fact that it was primarily used in the management of obesity and diabetes, particularly diabetes. Any comments or questions? If not, we'll go to the next article. This is an interesting consequence of the SGLT2 inhibitors. People with type 2 diabetes do get delirium, and particularly those who are over 80 years of age. And they're suggesting that these inhibitors are a good protection for that delirium that occurs associated with use of metformin and diabetes. People over 80, of course, if you're over 80 and you're taking it, you have no side effects, then this doesn't, you have to worry about it. But uh, if you're on the drug, this is a new finding of the fact that this would protect you against the delirium that can occur with metformin. And It's interesting that it's become most prominent patients who are over 80. So,
Dr. Calder, what's your definition for delirium? What does that include?
well, delirium is another word for actually dementia. So that when you talk about somebody who is uh, mentally unsound, that's the term that they use to uh, call delirium. And psychosis is used for some people, but delirium is a term that is used to denote somebody who's mentally unsound and is not uh, logical in thought processes.
Would that include hallucinations?
Uh, yeah, depends. If you have, yeah, the hallucination is a form of delirium. The question is this something that is rare or is it something that is very common? If it's common, then it would be considered a type of delirium. Yeah.
It changes the older you get.
Yes, that's yeah. Yeah,
So
those
the
over 80.
many behaviors that and it's becoming an issue specifically for me with friends and relatives that I begin to question their thought processes when I attributed it to their personality when they were younger. But am I missing an opportunity now to at least encourage them to seek a specific diagnosis?
Thank you for sharing. This is as we age, our friends often age along with us as they if they remain, and so this is something that becomes even more uh, important because just so many of our friends are becoming demented, and uh, uh, and one of the first signs is when they stop paying the bills and those kind of things, and that may be one of the first signs that their mental health is deteriorating, and so uh, as you interact with your friends and spouses, that's sometimes one of the earliest manifestations is they stop paying the bills. Some of my colleagues, that's how they identified that their spouses were uh, demented because they just stopped doing things that they normally did. And paying bills is one of the things that is easy to detect after they haven't paid bills for a month or two, and the lights don't go on and the gas is turned off, and yeah, so those little changes in behavior and doing the things that you normally do and they stop doing those things maybe one of the first manifestations of psychosis or delirium. Any other comments, questions? Okay, let's go to the next article then. Now, this again is another GLP-1 drug that is decreases the dementia risk in type 2 diabetes. And this is thought to be another reason why the GLP-1 drug may be preferred in some circumstances because there is a reduced risk for uh, dementia. Uh, is this sufficient to put people on GLP-1 drugs? And that remains to be seen, but it certainly is food for thought. Any comments on this? This is something that, as we know, for the most part, there isn't a cure for dementia, although we have medications that decrease psychotic behavior in terms of age-related dementia and Alzheimer's. We don't have a specific treatment for it, but these GLP-1 drugs suggest their use suggests that they can be helpful in managing some dementias.
Is there any particular GLP drug that they're speaking of?
Yeah, that's talking about semaglutide.
Oh, just this one. Okay,
Yeah, that's the one that they're talking about
okay,
this time.
this one. Okay.
But it may turn out that there may be others, but semaglutide was the one that they were particularly talking about this time. We know so little about how to really manage age-related dementia that when you have drugs like this that have an impact, it is attractive to want to use them. Okay, let's go to the next article. Metal ions, the next frontier in diabetes management. We've been talking more recently about the role of copper, zinc, and iron, manganese, and magnesium, and chromium. I just recently had one of my colleagues who identified these elements as being deficient, and it's hard to actually get blood tests. You have to have special tubes, and if you don't think about it, you won't be able to make a diagnosis because most of the test tubes will have some of these elements, these metallic ions. And so, and yes, they can cause diabetes and other conditions. So it's important to know about the fact that what is the copper levels, zinc, iron, manganese, and chromium levels. Most often, we don't think about these metal ions, but they are becoming more and more a cause of concern, particularly in people who have to be hospitalized and have to be put on intravenous medications. So the importance of understanding their role in managing diseases becomes something. We know about iron, but most of the other metal ions we don't know that much about. And so it requires an increased awareness of these metal ions. And if your doctor isn't aware of this, this is something that when they can't find other causes, they can look at the levels of these metal ions and see if they're normal or not. Just as there may be deficiencies, there can be overloads as well. So magnesium is not really included because that's so important for all of the enzymes in the body. So magnesium is an ion that we know about and we're well aware that you need to have it, but the manganese and chromium and the copper and zinc are more or less often addressed. Magnesium is well known. Manganese is another one that isn't identified. And then some of them are just frankly poisons like lead, arsenic, and cadmium. And so having any of them in your body is a cause for concern. And these are some of the things that are used to reduce some of those toxic elements. You rarely hear them discussed these days because they are usually identified when the usual causes of problems are absent. And so when they are absent, then you look for other causes. Any comments or questions about this? If not, we will.
I had a question, Doc, about chromium. I thought chromium was extremely toxic.
Chromium is, well, having a low, in other words, some amount of chromium is important to have in your body. Now, zinc and chromium you require very small amounts of them.
Yes.
But there are people who have zinc and chromium deficiencies. And you only look for those when all of the other elements, other chemical elements are normal. But yes, high levels of chromium are toxic, but for some of those enzymes, zinc and chromium and manganese and copper and zinc their deficiency can lead to diseases.
Yeah, I have to take iron daily.
Chromium is thought of as a cause of deficiency, as a cause of diabetes as well. Okay. We'll go to the next article. This is an article that talks about how shingles vaccine, the new shingles vaccine, contains compounds which decrease the likelihood of dementia. And this is something we are learning about just now. We've been using the vaccine, but not this particular type of vaccine. And this adjuvant apparently is the substance that guards against the dementia. And is one of the reasons that they talk about the shingle vaccine being anti-dementia now. It was a surprise finding that it did have a lower incidence of dementia. And now we know that it may be related to this component in the shingles vaccine. And this is something that is peculiar to the new vaccine, which is not present in the old vaccine. I don't know how many have gotten the new shingles vaccine, but this is something that is unique to this new shingles vaccine. Dr. Perez?
With the impact of dementia, and that's something that I definitely don't want. And anything that I can do to reduce the probability that that would happen, because the brilliant minds that I have seen being eaten away by dementia is heartbreaking. And with these new, I had my shingles vaccine. And it is something that you don't take, it's lifelong, I believe. So with this, should we consider being revaccinated, knowing that with every vaccination, though it is very low, there are certain risks.
Well,
Should that be a recommendation, especially as we're living longer?
I think that most I went to my doctor the other day, and he made a comment about that, and he felt that if you uh, had taken the old vaccine and you're over 7 years long, then you should take the new vaccine. And I think part of it was because of that the new vaccine does decrease the dementia risk. But he felt if you hadn't had the vaccine for less than 5 years, then he probably didn't think you ought to do it. But if you were longer than 5 years, he recommended it. John Buchanan?
My question is the action of this vaccine. How does it work with Alzheimer's? How does it stop it?
I don't think they know that, but they do know they found the association, uh, and they found that it's related to that component of ASO1. But why it's effective against dementia is not really known, just as we don't really know 100% why. Except for the vascular dementias, because the real problem is the lack of circulation. But for the other dementias, like Alzheimer's, we aren't precisely sure about what is actually causing, although we have a lot of ideas. So in this particular case, it's the AS01 aspect of the vaccine that is reducing the risk. But we aren't as knowledgeable about the causes of dementia as we would like to be. Any other comments or questions about this? Well, let's go to the next
One, and now I'm thinking about how important it is for diversity and inclusion. I know that probably dementia is far more important to older physicians than younger ones. So it's very important to make sure that we keep the pool uh, full of older seeking this information physicians.
Okay, thank you for sharing. Betty Blaylock?
I will say that this article has made me decide to get a shingle shot. I've never had a shingle shot, so I will be getting one this year,
Okay, well,
just in case.
shingles is such a
Yeah, I've
nasty.
known people with shingles, and
Yeah,
so
none of them are happy, let me tell you.
no, they aren't.
Yeah,
Yeah,
if
so
they had to do over again, they'd take a shingle shot.
yeah.
This is an interesting article, which is really brand new, which talks about a new endoscopic gastric remodeling of the stomach in a minimally invasive procedure, which relieves gastroesophageal reflux uh, and reduces the need for uh, proton pump inhibitor drugs because people who have GERDs usually have to take those kind of drugs, and this is a procedure, this is brand new, so it's not as available, but it certainly is something that makes one think about it, because this is a minimally invasive procedure that apparently uh, works. So uh, I think you need a longer experience on this, but certainly it makes you think twice about all the different procedures you may have to go through if you have GERDs, gastroesophageal reflux disease. And most of those people who have GERDs are on medications. And so if the medications work, then fine. Although the problem is that some of those medications you're taking for long term, they have other side effects. So this is food for thought. Uh, so you might mention this if you have GERD to your doctor to see what he thinks about it. Any comments or questions? If not, it's brand new. So now this is an article that is attractive in many ways because we've had many articles on microplastics. None addressed what to do about it, other than avoiding it. And you can't avoid it because it's in everything. And so they talk about, and even this is brand new, and they don't really quantify the extent to which apheresis, which is a process in which you take out aspects of the blood. You have the blood, the red blood cells, the white blood cells, and you have the plasma. And in the plasma, apheresis, plasmapheresis, they can eliminate the microplastics from the veins. But they don't talk about the extent to which it's reduced. In other words, did they get all of it? Did they get some of it? Get a little bit of it? And this study does not go into that detail. And it's actually in Germany. But it's a wake-up call to know that there is a process now that they're beginning to identify that microplastics we know is related to heart attack, stroke, and overall mortality. And it's found in every organ in the body. And so having an article that is addressing how to remove microplastics is the beginning of something that's very important. Any comment on this? Because we've talked about microplastics for a while, but I never had any real treatment for it. Talked about avoiding it, which seems to be almost impossible, but now we have a technique for addressing it. John Buchanan?
Yes, I'm concerned about this. You know, is everybody going to be plugged up to a apheresis machine?
No.
In order to
No,
do
but
that?
it's good to know that at least we're beginning to do something about it. This is the first treatment I've seen for it. So and I'm sure there are going to be other treatments, but I'm happy to see that at least somebody's doing something about it.
The issue I'm talking about, though, isn't apheresis where they take your blood and run it through the machine and
Yes, yes,
put it back
yes,
in?
that's correct.
And it
That
takes
is what it is. Yes.
2 hours. You can watch a movie and stuff.
What's that?
It takes 2.5 hours.
It may take longer. It depends what they're trying to remove, right? It's kind of like dialysis, but it's a special type of procedure that you can take out what components you want to take out.
Okay.
And I think this may be the beginning of something good, because this is the first therapy that I've seen that addresses microplastics. Any other comments or questions for this important beginning, I hope?
Darryl's hand is up.
Whose hand?
Darryl Armistead.
Go ahead, Darryl.
Yeah, I saw an article that said that microplastics attach themselves to fiber and brightly colored fruits and vegetables, and that when they attach them to the fibers and brightly colored fruits and vegetables, that you can pass them as fecal matter, that's a way of removing them from your body.
Thank you for sharing. Betty?
I guess I'm gonna be the John Buchanan this time and ask about the price.
Well, there's the known price because it's experimental.
Oh, okay.
Experimental is not available. It's just that
Okay.
plasmapheresis is done routinely for many conditions. But the exact nature of what this process is for microplastics is experimental only so far. Okay, let's go to the next article. This is an article that talks about vaccine hesitancy as contrary to vaccine resistance, suggesting that people who are vaccine hesitant can be convinced to take vaccines if they're given sufficient knowledge and information, and that it's our responsibility as clinicians to educate the public and the community so that the vaccine hesitancy can be converted to vaccine utilization. Vaccine resistance is another story because people have their reasons for being resistant, whereas the hesitancy may be something that can be educated about and actually modified into vaccine utilization. And I guess this article is encouraging us to try to get people to go from hesitancy to actually utilization. Dr. Perez?
Please share this information with the the Secretary of Health and Human
Why? He's got his mind made up. He's vaccine resistant.
You're right. You're
He's
right.
not vaccine hesitant.
Yes, you're right.
Okay. Let's go to the next article then. Now, this is, once again, we're getting to the situation where all specialists are advocated to be mindful of their patient's mental health, suggesting that we actually compartmentalize patients in the handling of their illnesses, and we tend to forget about their mental health issues. And this perhaps is why in most articles you see nothing about meditation, those things, yoga, and those things that really help the mind, because we tend to neglect and put in the back burner our patient's mental health. When in point of fact, as the psychologist who spoke to us that John Buchanan invited a year or two ago, without mental health, there isn't good health. And so we need to become more mindful of the whole patient and recognize that when you're taking care of the patient, that their mind is an important part of their health. And so this is just suggesting that the pediatricians, but the same is true for all of the specialists. And then you see more and more articles where they're emphasis on the behavioral health component of the illness, because we have a tendency to not treat the whole patient and to leave the mental health issue out of it, when in point of fact, it may be important, maybe an important part of all diseases. And that's what this article is actually emphasizing. Dr. Perez?
It was just a few weeks ago that we talked about it as its association with cardiovascular disease.
That's mhm. That's right. And it looks like more and more people are recognizing the importance of anxiety, depression, and all of those in all diseases. And I think it's a long time coming, but it's something that we should have been doing all the time anyway. But when you think about it, we've had the stigma about mental health for so long that we have to finally do something that we should have done a long time ago.
Our current president is making it very evident that it's essential.
Well, some would argue his mental health is an issue already anyway. Any other comments about the importance of our mental health?
And on that subject though, especially because we need to appreciate those strategies and people in diverse communities that provide care in that manner. So there are some insurance programs I know that now provide payment for pastoral counseling. Other buddies, just different ways that different diverse communities receive mental health services. And we, the vanguard of moving forward, need to be knowledgeable about it and advocates for those services being compensated because they lead to better overall health for our communities. Was that clear?
Yeah, but the other problem that exists, yeah, it's pretty clear to me that yes, that there are many ways that we aren't as knowledgeable about all of the ways that it can be provided. But one of the ways that we know is problematic is that many of the psychologists and psychiatrists are not accepting insurance, and so that is a issue to me. That is a great issue is that knowing whether or not you as a patient can be accepted by the psychiatrist and that your insurance can be acceptable as a form of payment because some are not accepting insurances. And that is one of the big hazards of mental health is who's paying the bill. Betty?
Yes. One of my grandchildren, when he was young, the school, I guess the school nurse, or I don't really know who did the diagnosis, but he was diagnosed with ADHD. And because of that, he was put into a special group, moved from the regular children and put into a special group. And it followed him all the way until I think it started in the third grade and it went all the way until he had a altercation, and in the 10th grade he came out and went to a regular school. But into the regular curriculum. But because he had been in that program for all those years, a lot of things that he needed in order to graduate, and he did not have. And later on in life, he graduated with his class, but he didn't have some of the necessary things that he thought he should have gotten during those formative years. And so I guess my question really is, who should be doing the diagnosing these kids? I mean, just like you said, a lot of parents don't have the money to go to a psychiatrist or a psychologist, and the school system just did it. And as a result, he ended up not having some of the skills that he probably would have gotten had he been in a regular structured school. From what he said, the ADHD classes were more talking about his behavior and not what he needed for skills for learning. So I'm just wondering who should really be the person to make those decisions.
Well, it's actually a medical diagnosis,
Yeah.
and it's common at all levels. I have people in medical school who have ADHD, and it's just diagnosed then, so that it's a medical diagnosis, and the nurse could make the diagnosis. But there's treatment for ADHD, and the treatment for ADHD, there's medications that they put you on that should allow you to go through school, not prevent you from learning what you're supposed to learn in school. And I think that's a medical diagnosis, and that's the way it should be handled, and it should be treated in that fashion. It's amazing to me that I find many significant number of medical students who have an initial diagnosis of ADHD in medical school. So it's an issue that is important, but I think it's a medical diagnosis, and it doesn't need special classes. It needs special treatment.
Hope
I
they've
had a
changed
question.
some of that. But
I'm sorry.
Dr. Buchanan, John Buchanan, you had your hand up?
Yes, yes, I did. So you answered one of the questions with ADHD being medication that
Yes.
these kids get. I'm from my experience as a teacher and kids who are treated with that. I mean, some of them can become addicted to that treatment. Also, though, is there with ADHD, is there shoot. I got distracted. I'm sorry. The the treatment for ADHD being medication, all right. Is there a way that the ones you were talking about in grad school or in medical school with ADHD, what are the symptoms of ADHD?
Well, there are many ways they manifest itself. Some of ADHD is manifested by how people perform on objective examinations, and sometimes that may be one of the manifestations. Is that they need more time to take examination. They need special In other words, they when they take examinations, they don't take them the same way with regular people. So, and yes, they are given medications, and yes, some of the medications they have to take for quite a while. Uh, but sometimes the manifestations are that they don't perform well on objective examinations. And that may be one of the earliest indications. And then, of course, you've got many other manifestations in which they their attention span is very short, and they are wandering all over the place instead of concentrating on things. So sometimes that's one of the earliest manifestations that they can't concentrate and they can't stick to the subject. Maybe one of the early ways that you tell, and then they manifest it in behavior problems in which they don't conform, and sometimes, and that's why this becomes a situation in which it's a medical diagnosis needs to be made in terms of whether this is uh, a, a disease entity that needs to be treated, uh, rather than just put in a class with other people who don't behave appropriately, uh, because uh, this is a specific diagnosis that is made that does have a specific treatment. Does that help address your question?
Yes. Thank you. Thank you for that. I'm looking back at my education. My reading speed was very slow, and I might have some dyslexia
Yeah.
issues. I had to get on I had to take reading in college at Notre Dame. I had to go to a reading to learn how to read, because we had to read a novel every week on top of chemistry and physics, and physics was calculus, and uh, reading slowly was undiagnosed the whole time I was in school until I got up there. So
Yeah, you bring up an excellent point. Dyslexia is a condition that is thought to be part of the ADHD complex, and it does it is treatable, and it does require special. Uh, in other words, the time that you take an examination has to be treated differently than for other people. And sometimes that recognition is not made until graduate school. For you, it was in college, but for some people, it's actually in medical school, which is it's amazing that it could be around for so long and not recognized. But it's more common than you would think, and especially with your children and grandchildren, it's important that if they have those conditions, that they be treated as early as possible so that they can uh, not be mismanaged along the line, along the way.
Dr. Perez?
As a pediatrician, it was something, especially taking care of primarily poor Black and brown children. It was the main thing I advocated for, because the diagnosis wasn't made clinically. Um, and there is, I think, a big gender difference between hyperactivity and inactivity. Um, and we revolutionaries have fought very hard to make sure that there is not alienation but inclusion of children with a myriad of learning differences not being expelled from the quote unquote general population, but that there be inclusion. And whatever strategies, like you mentioned, Dr. Calendar, having a longer period of time to be able to take an exam, to be put in a room without lots of distractions, to bring out the things that we know that ADHD is made worse by. The fact that we now have a warning for certain movies that have flashing lights. All of this has come from a lot of advocates to make sure that the general population, our community, is ready and able to support these young people with different medical, physical, and hormonal conditions that we have now identified as being this syndrome or different gradations of learning disabilities or learning challenges. I
When
was
you,
diagnosed with ADD by my daughter, who was in medical school. And you hear me? My daughter, my daughter, one of your students said, Mommy, I think you have ADD. And it came at a time with hormonal components because I was in menopause. So now we have a plethora of research that shows that certain hormones then have that impact. And people, Mr. Buchanan, it speaks more to your brilliance that you were able to compensate for dyslexia and ADD that nobody knew it. You compensated for it. So anyway, I just wanted to share some of that and the racism associated the attack on Black boys, especially in this arena. There's some of us Black Panthers that really push to make sure that
okay, thank you for sharing. Very enlightening. Okay. If there aren't any more questions, we'll go on to the next article, right? This this is interesting because here we are getting the AI issue that the AI perform better than the doctors in predicting the risk of cardiac arrest in patients with hypertrophic cardiomyopathy. We're seeing something in cardiology that we've seen in radiology and we've seen in other areas, and that is that AI, along with the doctors, can optimize the treatment of patients. And so there's no reason to separate them. They should be brought together so that the patients can have the optimal experiences. And so I think recognizing that there is this model that can do even better than the physicians alone uh, emphasizes the importance of artificial intelligence along with the physician being necessary to get the best health care for all. And this is just another example of it. We've talked about this for a while, but this is a good example of it. We're not competing one against the other, but we're together trying to get the best treatment for our patients. And AI in some areas is what is necessary, along with the physician to optimize diagnosis. And this is another instance in which this model is even better than the doctor alone. And of course, the end result in this situation is eminently important. Any comments or questions as we address this phenomenon of AI and science and medicine and other issues? No comments? Okay. Uh, this next article then focuses on not recognizing the fact that you have impediments to moving forward, but recognizing what you can do and moving forward on that basis. This talks about how in older times we restricted people because of their medical diseases without really finding out what actually they could do and helping them to move beyond that, to do something that was in their best health interests, but yet not counterproductive to their morbidity and mortality. And in this case, what they're suggesting is that we find out what patients can do and are able to do in spite of the obstacles that confront them. And then when we do that, we're better able to have a person to maximize their abilities rather than being restrictive. We're expansive. And that's the philosophy that people have used recently to increase the physical activity that people can do and not limit them as much as we tend to do. I know when I had my lung part of my lung removed, there's a natural reluctance to do a lot of physical activity, but I resisted that and did what everybody else did. So that if you then recognize that some of our limitations are, because of our fear of what can happen, rather than recognizing that we can expand and let them do as much as they can without uh, having a cost to pay. And so that's what this article is really all about, is recognizing that, emphasizing what the children can do in spite of whatever limitations they may have. And physical activity is just one of the pillars of a healthy lifestyle. So I'm sure that many of you understand what that means because when you have a health uh, problem, uh, some people can use that to uh, completely limit their physical activity, when in point of fact, there's many things that they actually can do, but they're just afraid to do it because of the counsel that they've received. And this article is saying expand it. Hey, see how much they can do without uh, paying a price. And why not? And I think this is a creative program of activity that is, exactly what is done in orthopedics and in most other specialties. And we don't try to limit. We try to expand as much activity as possible. That is not hurting the patient. Any comments on the essence of this article, which is uh, encouraging the patients, the children to be active, be creative, and not be isolated. Any comment or questions? I guess it speaks for itself. So, okay. Well, let's go on to the next article. Oh, Betty Blaylock? You had a question, Betty? Comment?
I was hesitant at first, but I completely agree with that article because as I mentioned a couple of years ago when I had my last hip replacement surgery, I ended up with drop foot. And so of course I have been wearing a brace ever since then, but I have learned to not wear the brace around the house. I usually put it on, most of the time I put it on when I'm going out. Sometime when I'm trying to really call myself dressed up, I won't put it on. But around the house, I just have continued to do my regular household chores and things like that. And I've been the last month or so, I've been focusing on cleaning my kitchen. And my husband has continuously tells me when I get up on the ladder that he's afraid, but I'm not afraid because I've been doing it all the time. And just because I had one foot that doesn't work quite as well as it used to, I don't let that limit me. I go ahead and do it. And just yesterday, he said, he asked me if I was still in the kitchen, still doing my chores. I said, yeah, I'm cleaning the cabinet out. And he said, well, I'm glad I'm upstairs so I won't see you on the ladder. But it has not stopped me. I'm going to continue as long as I possibly can to do what I had been doing all the time. So
Thank you for sharing. Any other comments? I think this would be that would have been our last article. It's 10:30. So I think that's a good note to end on because I think that's I think it's important to recognize that sometimes we can be our own worst enemies.
and I'll also add that tomorrow will be my 81st birthday, but it has not slowed me down.
Wonderful. Congratulations.
Happy birthday!
Thank you.
Happy birthday.
Wow.
Wow, 81, huh? Okay.
One.
So you're in this category of 80-year-old people who can
Yep.
address some of these issues.
I was talking to my godmother on yesterday, and I'll tell John Tatum knows who I'm talking about, one of the deaconess at our church. And I told her that I would be that my birthday was tomorrow and I'd be